Good afternoon. My name is Lauren Zuga, and I am applying for the Postmaster Certificate for Midwifery. I am currently a women's health nurse practitioner where I live in Northeast Ohio. I live in a smaller, I would say we are a suburban, rural area. I've been a women's health nurse practitioner for just 6 years, and I have been a registered nurse for 12. I began my journey in an ICU at the Cleveland Clinic where I quickly realized that it was probably not for me. I then moved into labor and delivery in my smaller town, which grew to be something I loved. I love providing care in a smaller setting, and I fell in love with women's health. I chose at that point to go gain my master's degree at that point because I was noticing a huge exodus of providers in our area for women. And that was something that I felt that there was a huge hole in and something that I was genuinely passionate about at the time. And I am still now, but that's where I saw the need, and I felt that it was something that I would be good at and what I would love. I did not choose midwifery at that time based on a few different things. Midwifery, there were none practicing in the hospital that I delivered at. At the time, we had about 400 deliveries a year. By the time I left, it was about 800. But we were not a very midwifery-centered area. It was not something that was really accepted or even talked about at the time. So given that I was younger, I think I lacked the confidence to kind of make my way there, but I really, really loved women's healthcare. So I chose to do women's health, and I moved directly from labor and delivery after I graduated, working in a private practice with a physician that I had worked with at the time. I'm still there. I love what I do. I love the patients that I see. I see both GYN and OB, probably 50-50. I see a lot of both. We're a pretty busy practice. Our deliveries have nearly doubled a month in the last 6 years as we've lost a lot of providers in our area. So there's a definite need that is visible. I also now have decided to return to get my midwifery certificate, not only because the need is there. I have felt it every day in my work, but I'm also missing out on a huge part of my patients' care. I bond with many of my patients. I see them a lot. We spend a lot of time on education, questions, multiple babies. Some I've seen for many years, whether from labor and delivery nurse to now I'm a provider for their next pregnancies. But I feel as though I'm missing out on that portion of care, especially when you have a bond with the patient. I also feel like I am a more competent nurse, a competent provider. We have one midwife in the area now, so it's not exactly like I have a ton of company, but I feel like with the experience that I have and the time that I've put in, I am ready to pave that way without it being something that is extremely popular where I live, but the need is huge. I also work with an excellent collaborating physician who has been extremely supportive of my journey so far, supportive of me not being ready, and now really just having my back in something that I want to do. I feel very confident that he will be an excellent person to work with continued, and I feel that he is going to be very supportive of this for me. So that is why now seems to be the right time for me personally. The specialty of midwifery, what is it to me and why am I choosing to pursue that? That role for me is a curious provider, a provider that is willing to listen to patients, recognize unique needs, and be supportive of that. As a midwife, safe, competent care is absolutely on the top of my list. And I think midwives, we know advanced practice nurses spend a lot of time with their patients, and I already do that. And I know that that's something that is really important for me in the obstetric experience. I also want patients to feel empowered, feel like their voice matters, feel like they have a say in their birth, in the beginning of their child's life. I provide that now in the office, but I want to be able to take that into the delivery room as well. So that is the role for midwifery for me, is safe, comprehensive, curious care that really empowers women in their journey to their next baby or their motherhood. Choosing Shenandoah. A couple different reasons that I'm choosing Shenandoah is I have someone who is in a very similar situation to me. She was a nurse practitioner first and opted to come back, and she had a wonderful experience at Shenandoah. I have thought about this for a couple of years. We've talked about Shenandoah multiple times. So she had a great experience. I've also contacted various schools, and I felt that Shenandoah has given me the best personal I guess, customer service as a curious student calling. I've received great feedback. I've always been able to get a hold of a person. And I also read and looked at a lot of videos from your previous students. So I have a personal connection, but also have been treated very well by the staff there. And I feel very excited about it. Graduate school being 20 hours a week. I do not work full time currently. I am still a part-time role. I have young children, but we're school aged. So while that offers a different busy, I do believe that I can fit those 20 hours into my work week. I also have, again, a very supportive provider in what I want to do. So the challenges will be working, seeing patients, doing my charting, and then also being able to fit book work in as well. But I do have some days in the week where I can chisel that out. But I am no stranger to the challenge of graduate school. When I went back the first time, I got married, I had a baby. We had some other things happen. And while it's challenging, sometimes I think when your plate is full, you function a little bit better. Also, when we get to 35 hours a week, I can adjust my work schedule because this is something that I've been talking about. My work, the physician I work with, the office staff is extremely supportive of that. So I will be able to adjust my work hours. I can't get rid of all my life responsibilities. But again, as a midwife, I feel like that's something you just got to do. You know, the babies come and patients need you and you just learn to adjust. Absolutely. If you talk to one of my colleagues, a family member, my friends, what is one of my strengths? I think communication is a strength. I love listening. I love genuine conversation. And I think that I have an empathy that I can listen to patients, friends. People talk to me a lot about their problems because I do genuinely care about them. It's not just lip service. And I do think that communication is a great skill for me. Weakness is that I'm not very good at delegating. I take on a lot and sometimes I can overwhelm myself, whether little tasks at work, in my family life, I need to learn to delegate, whether that is calling a patient back about something that could be delegated in the office or having someone else in my household do the dishes. So I like to get things done how I like them, but I'm also learning to adjust because I can only be so many people. But delegation is a weakness and communication is a strength of mine. So I am really looking forward to pursuing my midwifery degree with Shenandoah. And I hope to be a graduate that you can be proud of by providing care in a more rural setting where we desperately need people that care about obstetrics, as so many people leave. Women are not going to stop having babies. And it's something that I'm already passionate about, and I'm just ready to move to the next level as a more confident provider and really dig in and add those skills so that I can help the women that I serve in my community. I look forward to hearing from you, and if you need anything else from me, all my information is available. Thank you for your time.